Health Info, bringing you well-researched medical information. Welcome to the third part of the series, discussing different tests you need to regularly take in order to manage your diabetes well. Since there are many tests patients need to take, we have divided the list into 3 parts. This is part 3, which will discuss cardiac and lipid function tests. Do watch the parts 1 and 2 that talk about other diagnostic tests in diabetes. So let's get started. Let's talk about the role of blood pressure in managing your diabetes. The World Health Organization states that high blood pressure is a serious medical condition that can affect many organs in the body, such as the brain, heart, and kidneys. For people with diabetes, the risk of high blood pressure is greater because the two conditions share similar features. According to a survey from 2012, obesity, inflammation, oxidative stress, and insulin resistance are common for both hypertension and diabetes. So what exactly is the connection between the two? High glucose levels in the bloodstream are very damaging for the blood vessels. Because of this stress on the vessels, the heart pumps more blood, resulting in hypertension. It is important to have regular checkups of blood pressure levels to take action if the measurements are not in the normal ranges. This chart provides information about the different ranges of blood pressure and what they indicate. It is a good idea to keep a log of your blood pressure entries to see the trends and how different activities, foods, and stress levels affect your blood pressure. CD heart and calcium stores. The computerized tomography or CT of the heart, along with the calcium scores tests, help spot calcium deposits in the vessels of a patient's heart. More calcium means more coronary atherosclerosis, which is the hardening and narrowing of arteries. These tests help identify patients who are at a higher risk of developing heart diseases. Electrocardiogram or EKG. EKG is a test that measures the electrical activity of your heart. Your doctor will be able to check for things like heart rhythms that aren't normal, a larger than usual heart chamber, poor blood flow, and heart attack. Holter monitor. The ambulatory electrocardiogram or a Holter monitor test measures the electrical activity of your heart while you go about your regular daily activities. A Holter monitor is a small, wearable device that records the heart's rhythm. It's used to detect or determine the risk of irregular heartbeats, which are called arrhythmias. Patients may be recommended Holter monitoring if they experience arrhythmias, any conditions that increase the risk of arrhythmias, or have had episodes of unexplained fainting. Echocardiographs. The echocardiograph or echoes use ultrasound to give your doctor a graphic outline of your heart chambers and their movement. Echoes help check your heart's structure and motion, see how thick the heart muscle is, and how well your heart is pumping. Exercise stress test. The exercise stress test is a treadmill test that helps your doctor find out how much blood flow gets to your heart muscle when it works hard, like while you exercise. Depending on the blood flow, your doctor can give you a range within which it is safe for you to exercise. Coronary angiography. Coronary angiography, also known as cardiac catheterization, is a type of X-ray used to check blood vessels. Human blood vessels do not show clearly on a normal X-ray. Therefore, a special dye called a contrast agent is injected into the blood first, which highlights the blood vessels. The X-ray images created during angiography are called angiograms. These images allow the doctor to see any problems within the blood vessels. Angiography is used to check the health of your blood vessels and how blood flows through them. It can help to diagnose or investigate several problems affecting blood vessels, including atherosclerosis or narrowing of the arteries, which could mean you're at risk of having a stroke or heart attack. Peripheral arterial disease, which means a reduced blood supply to the leg muscles. A brain aneurysm, which is a bulge in a blood vessel in your brain. Angina or chest pain caused by reduced blood flow to the heart muscles. Blood clots or a pulmonary embolism, which is a blockage in the artery supplying your lungs. A blockage in the blood supply to your kidneys can also take place. Finally, angiography may also be used to help plan treatment for some of these conditions. Lipid profile tests. As a person with diabetes, you should have your blood lipids checked at least once a year, or as advised by your doctor. Fasting lipid tests. Some tests are called fasting tests. This means that you must have your blood drawn only after you have fasted or not eaten anything for at least 9 to 12 hours. A blood lipid panel helps detect dyslipidemia. The blood lipid panel includes 4 main categories of lipid packages or lipoproteins: total cholesterol or TC, low-density lipoprotein or LDL, high-density lipoprotein or HDL, and triglycerides or TG. When healthcare professionals look at the results of a blood test, they want to see a total cholesterol level of 200 milligrams per deciliter or less. The total cholesterol is the sum of the cholesterol in LDL, HDL, and triglyceride particles. For LDL, or low-density lipoprotein, a healthy reading for someone with diabetes is 100 milligrams per deciliter or less. If you have diabetes and heart disease, the desired number is 70 milligrams per deciliter or less. LDL is often called bad cholesterol because it transports cholesterol to cells. And cholesterol from this particle can get deposited in blood vessel walls, causing atherosclerosis. For HDL, or high-density lipoprotein, a healthy reading for women is 55 mg per deciliter or more. For men, it is 45 mg per deciliter or more. HDL is considered the good cholesterol because it is like a garbage collector. This particle picks up cholesterol from blood vessels and other locations and carries it back to the liver for disposal. For triglycerides, a healthy reading is 150 milligrams per deciliter or less. The triglyceride blood particles carry triglycerides throughout the body. Since a small portion of the triglyceride blood particle is actually cholesterol, when triglycerides go up, the total cholesterol also goes up. Similarly, when the triglycerides levels drop, the total cholesterol level also drops. Finally, we talk about the importance and role of diabetes education. Research has found that patients who educate themselves about diabetes fare better than those patients who don't. This is because educated patients are more likely to use primary care and preventive services, take medications as prescribed, control their blood glucose, blood pressure, and cholesterol levels, and face lower health costs. Diabetes self-management training is a benefit covered by Medicare and most health plans when provided by a diabetes care and education specialist within an accredited or recognized program. So there you have it. A comprehensive guide on how to keep a check on your health as you manage your diabetes. Knowing the purpose of different tests and how they contribute towards understanding your overall health may inform you to make better lifestyle choices, improve dietary habits, and live a happy and fulfilling life. Do review the Part 1 and Part 2 in this series to learn about the different types of blood tests patients with diabetes need to undergo on a regular basis. Keep watching our videos to learn more about diabetes. If you like our videos and want to learn more, please leave a comment below. Subscribe and share to help others.